The public's attention is usually captured with regard to the topic of suicide when a celebrity unfortunately takes their life. Unfortunately, many people struggle with mental illness, and unfortunately suicide is an all too common outcome. The Center for Disease Control actually estimates that approximately 50,000 people lose their life every year due to suicide. Along the lines, mental illness is a very broad topic. Certainly one of the major mental illnesses that confer risk for suicide is major depressive disorder, to which there are multiple signs and symptoms beyond the depressed mood itself. Those symptoms can include a loss of interest, of course suicidal thoughts, impaired or disturbed concentration, or an inability to remain focused, and especially a change in sleep pattern or appetite. If a close friend or family member is suspected to be struggling with depression, if they're withdrawn, if there's any change in behavior or any suspicious or concerning behavior, it's critical that you talk with them. In talking to them, you may uncover that they in fact are struggling with a depressed mood or a loss of interest in one's pleasurable activities. And at that point, you can get them or assist them to seek help, certainly through their primary care physician or psychiatrist. In clinical medicine, suicide attempts are sometimes referred to as cries for help. From a clinician's perspective, I think that any suicide attempt should be taken very seriously. And only after the patient receives help that they need can one then maybe go back and understand the true nature and intent of why they did what they did. It's critically important to address mental health issues because only by mainstreaming and talking about these issues in the same light as one would talk about a heart attack or even cancer do we overcome the stigma and send a message to people that these are real illnesses that have natural outcomes and that have real treatments in place so that people can get the help they need.